I'm Dr. Alan Muskett from Billings Plastic Surgery, and I'm here with Tricia Kelly, who's a registered nurse who works here at Billings Plastic Surgery as well. And what we're here today is to talk to you about breast augmentation. Now, you see a lot of advertising for breast augmentation, a lot of fancy websites, but we would like to give you today kind of a real view of what breast augmentation is like, what it's for, what to expect, and really pretty much everything you need to know about it. So I'm going to start off first, and since you're more likely to believe her than me, I'm going to ask Tricia, first of all, who does consider breast augmentation?
Well, of course, there's a range of people that consider breast augmentation, but within our demographic, Montana, probably the majority of women that we that come to our facility to consult on breast augmentation are women in their 30s, just had a couple kids, and want to have their bodies back, have the volume replaced that they've lost with pregnancy and breastfeeding and that type of thing.
And there's also another group of women who just really never have much breast development. You know, there's sometimes we'll see younger patients where they grew up and simply didn't have development of their breasts. And I would say for the most part, you can correct me if I'm wrong, that most of the patients we're seeing are not average sized women who want to be huge. I think there's a real misconception that we get from television or shows like Baywatch or posters or people that breast augmentation means that you're going to end up with huge breasts. I think for the most part our patients are people who've had loss of volume due to pregnancy, have never had breast development, who are just looking to have normal proportion for their figure. What is your feeling about that?
We're not Las Vegas, we're not Florida, we're not California. We're people that are very reasonable and want to just have normal proportion, body proportion, and feel more feminine or have it replaced that was lost.
Now, would you say of our patients who've had breast augmentation, there's obviously thousands of them running out there, can you tell they've had breast augmentation?
No. Typically, no. I mean, you really have to outstretch your volume and come out of proportion of your body to really be able to say that person has had a breast augmentation. Kind of our goal in breast augmentation here is to make it very natural and have it fit your body and not go out of proportion, to where it is very natural and no one can say, hey, you've had a breast augmentation. Absolutely.
I think one of the things too with breast augmentation is that we have to consider that you are adding some weight to your body, to your skeleton, and it doesn't take a lot of weight necessarily before you can start feeling it in your neck and shoulders. So the very large implants that you see in say television shows, or you see in maybe actresses or public figures, very often those can put strain on the neck and shoulders. So what we strive for here is to give you what you want in terms of volume, in terms of the look, but not cause problems with your neck or shoulders over a long period of time, and this really can occur. So let's talk about the process. Let's say that you're interested in breast augmentation. The first step would be to make an appointment here to see one of the physicians. And now if you're a patient coming in, say what kind of questions would you have of the doctor?
A lot of the real common questions that people come in, one is what size am I going to be? They usually come in with a cup size in mind, not so much volume size, which is what we deal with. One, recovery, as far as how long it's going to take to feel like kind of back to normal or can do activities that you're used to doing. That's pretty much the basics. We start digging into a little bit more when we start talking to patients about occupation, what they do, again, their goal and size and their reasonability to attain that if it's possible. Lots of those types of things. And then, of course, concerns with any kind of basic surgical procedure, infection and bleeding, and that's never zero.
Right. So I think one thing that we offer here at Billings Plastic Surgery is a very comprehensive consultation. So we'll talk to you about the options that you have as an individual. We do very precise measurements of the diameter of the chest, all the different measurements that occur in a breast examination, so that we can fit very precisely the implant to your body. We talked about things like what kind of work do you do, when can you return to work, what are expectations in terms of recovery, how long will it take you to see the final result. So one thing that's very important is when dealing with breast augmentation, you want to make sure you have a board certified plastic surgeon, not somebody that took a weekend course, and that you have somebody who has a lot of experience and someone who really understands the process well. And we feel very strongly that we do a good job of that here. And then we talk in great detail about the procedure so that you understand what you're getting into. Now, there are different kinds of approaches to doing breast augmentation, and there's a lot of things that you see in advertising that you need to know about. There's the most common incision is the one under the breast, where the implant is placed under the muscle, and that's through an incision about that long. It's about just under 3 inches in length, and that's probably the safest incision with the lowest incidence of long-term problems. People have talked about putting implants into the belly button. Those can only be saline implants, and for the most part we're doing very few saline implants these days. There's an incision in the armpit where the implant can be placed in through the armpit. We've also seen some significant problems with that as well in terms of nerve injury to the nerve of the arm and also the placement of the implant. So there's different considerations for each of these approaches, and we'll explain each of those to you so that you have a good understanding. Tricia, what happens after the procedure? What is the recovery like, and what would you advise somebody in terms of what to expect after the surgery?
Well, I always tell patients, particularly right after surgery, they're going to look like we just kind of went and stuck them on your chest. They're going to look, they're going to look tight. They're going to look high. They're going to just look like we suction cup them to your chest. It takes about 6 months for everything to happen, that being all the swelling to come out of the breast, the skin to relax, the muscle to relax, the implant to kind of find its own little spot to give you more of a natural breast shape, and to make it look like a natural breast versus a suction cupped breast to the chest. And that takes about 6 months for all that to happen and for the ripening process to take place. Recovery-wise, as far as pain, discomfort, kind of getting back to normal activity, everyone can be a little different on that, but on the average, I tell patients it's 5 to 7 days that you could get back to work. That's always the big one. Yeah. When can I go back to work? Obviously important, and it's about 5 to 7 days.
Now, what about when can they get back into a normal bra, for instance?
Well, we like to keep our patients in a compression bra total almost to 8 weeks, mainly because one, we want good support of the implant and support of the inframammary fold to let things scar down and let the swelling come out. And you're not going to be really able to size with a bra until that swelling does come out, and that takes 8 weeks.
Now, one question I'd ask too, you've seen thousands of patients with breast augmentation. What do you think the degree of satisfaction with the procedure is?
It's high. I find it's very high. Women, again, coming in either not having any at all and have had battled with just wanting to look normal in a swimsuit, not look like a boy. Feel feminine, wear a nicer, little nicer dress, sundress, or something like that to fill out. Goes a long way in women's confidence and making them feel more feminine all the way around.
And I found that very interesting because the satisfaction rate in our practice with breast augmentation is 98%. And that seems to me very high because, for one thing, 98% of lottery winners aren't that happy. It's just odd. But even people who might have had a problem with the procedure have a very high degree of satisfaction. So that gives me a lot of confidence in recommending it to patients because it's just a very high degree of satisfaction, and that's a pleasing thing to see as a surgeon, but also gives me confidence to recommend it to other people. Now, the other question that comes up with breast augmentation is, do I need a lift? What are the things that would tell us that a patient needs to have a breast lift as well as implants?
Well, that depends on the degree of what we call ptosis. That's sagging, layman's terms of droop. Sadness, whatever, sadness. Deflation. That's right. A couple of terms that you could use. But depending on the degree, obviously you can certainly go through changes, whether it's weight loss, you have weight gain, then have weight loss, and or pregnancies, breastfeeding, all those things play into it, where tissue's been stretched. There's varying degrees. So not everybody necessarily needs a lift with an implant. And there's measurements and things that we do and look for to decide whether or not that person is going to need a lift in conjunction with an implant at the same time.
And I think probably one of the best indicators is if you look at the position of the nipple on the breast and look at the position of the fold under the breast. If the nipple is falling down below the fold under the breast, usually a lift is indicated. But that's something we go over with you in the office. We show you pictures, we show you the incisions required. There are several different kinds of lifts depending on the needs there. But that's something that we go over during the consultation, and then let you decide, whether or not that's something that's appropriate for you. Let me just describe a little bit about how the surgical procedure works. First of all, it's an outpatient procedure. You'll come to our office in the morning, see an anesthesiologist. There's an intravenous line placed. Go back to the operating room, go to sleep, and the procedure takes between 30 and 60 minutes depending on the complexity of it. And we go back to the recovery room and usually spend a couple of hours in the recovery room and then go home. You do need to have a responsible adult with you to take you home and spend the night with you. And then we'll see you the next day to check on everything and assure that you're off to a good start. We'll usually see you at that point from 2 to 4 weeks post-operatively to make sure that things are progressing well. So it's not a long operation, it's a very safe operation. I think that's an important thing. If you have children, you have family, you have responsibilities, you want to know that you're safe. We also use board certified anesthesiologists. We use a fully accredited operating room, state-of-the-art equipment, and certainly board certified surgeons. I think one thing that's very important when you're looking at breast augmentation, you'll look online and you'll see some prices that are lower than other prices, but it's important to realize there's differences in what you're getting, in terms of whether you're getting a fully qualified surgeon, whether or not you're getting a fully qualified anesthesiologist, and these are things that are very important to the outcome of your procedure. So the differences in prices are generally not real large, but the difference in quality can be very high. So I think that when making a decision, it's very important to realize that this is your health, this is your body, and this is a time to get the very best. I feel like our prices are very competitive, especially for the kind of product we're offering. Let's talk a little bit about implants themselves. We have a new generation of implants now that are kind of the latest, greatest thing called Inspira, which is kind of a cool sounding name for an implant. It's a little overblown. But there are, I think, basically two kinds of implants in the market right now. There's that which is a silicone envelope filled with saline, which are called saline implants. And then there's the silicone gel implants. So why don't you tell me, Tricia, what's your thought about on those two kinds of implants? What have been your observations in your career?
Well, when I first started here at Billings Plastic Surgery, 10.5 years ago, I walked into a time frame where all we could do was saline implants, and that was all we had choices of. There were some loopholes that someone could get gels, but primarily it was saline for for someone seeking augmentation. about 3 years, how was it, probably about 8 years ago now, they then were now released on the market. Way back when, 40, well, I'd say 20 years ago or so, there was a big scare that gel would leak out of the gel implants and run around in your body and cause connective tissue disorders and other stuff. So they were pulled off the market and studied very intently and intensely as far as, you know, those types of concerns. In fact, we were an investigative site at that point to look at that specific issue for many, many years. And we saw patients at 1, 3, and 5 years, and asked a bunch of questions. Long story short, after data compiling and all that, totally not connected. They weren't able to make any connection with gel issues. That's what most people are worried about when they come in. They say, gel, well, I hear it's not safe. I'm scared about it. They've been around a long, long, long time. Say 40 years at least, easily. So really, they've been tried, they've been true, they've been tested, and they just haven't been able to make any real connection with anything. So that part you can kind of put to the side. Now, you know, with saline versus gel, saline tends to feel harder. You think of it, fill up a water balloon and you push on it, it's hard. You take a gel substance, put it in a balloon, and it's going to feel squishy. So gels tend to feel more natural, particularly if you don't have a lot of breast tissue to begin with, or soft squishy, I call it. If you don't have a lot of soft squishy, then a gel
That's what we want.
a gel implant will certainly make things feel more natural. You have less rippling issues. Rippling, what's that? Well, if you have thin tissue or not a lot of soft squishy, gel or silicone saline can get what we call rippling, of what you can see with the balloon or the water sac that's, you know, underneath the breast tissue. So gels have less incidence of rippling. They are more natural, softer, and I think they tend to give a little bit more support and lift, because you actually are inserting a solid versus a liquid into the tissue. So it has more lift power and a little bit more support, and they just look softer. And more
I think
gentle.
so too, and I think you can tell looking at them, or you can't tell, which is even better. You can't tell they're there. Okay, I'm going to show you a few examples here of the different kinds of implants. Now, for instance, this is a saline implant, and that is a silicone envelope which is filled with salt water. And so this is not completely full, but you kind of get the idea of how there's fluid inside that implant. Now the next thing up on the ladder is a traditional silicone gel implant, and you can see they have more shape to them. There's still a little bit of a ripple on top of this implant here, and these have been very good implants for us, but one of the problems was still a little bit of this kind of rippling there. So the newer generation of implants here are what are called the highly cohesive style, and they are filled more fully with silicone, so you can see they have a little bit more shape to them, give a little more projection on the chest, and there's less of that rippling effect. And at the far end of the spectrum is what's called a form-stable implant, and this is the one that comes, you can see, in a teardrop shape, and this has the shape pretty much completely built into it. Now this would seem like a really cool idea because it's shaped like a breast. The problem with these, in order to get the shape, they're a little firmer. So one thing we found, these work really well in breast reconstruction, but for breast augmentation they've got a little bit of an edge on them and they're a little firmer. So I think for augmentation probably they're not quite as desirable as these newer implants, which are round and smooth and have a little more fill in them, but they're not quite as firm. So the point is that we have many choices for implants, and what we try to do is customize an implant just for you. The most important thing is that we determine what your size requirements are, and then make sure that implant fits on your chest. And we do that by making very specific measurements and heights and diameters, and then we can choose a device. We have literally hundreds of these to choose from. so that we can get one that's completely customized to you. Some of the questions that I would have is, how long do these things last? I would say on average that a breast augmentation will last somewhere around 25 to 30 years. Now, that's based on our experience now with implants that were put in 25 to 30 years ago. Now, I don't know if these newer generation, which are a much improved product, will last longer, but based on history, you can figure if you get a breast augmentation at a younger age, probably at some point in your life, you will need a replacement. So that's something that you do have to consider, is that this is probably not a permanent device, but it should be something that would last you a good long time. And it's very possible too in the future that we won't be using implants, but we'll be using some sort of a clone device or some biological tissue to replace it. So I would say that breast augmentation is a safe procedure. The satisfaction rate's very high, that there seems to be a significant improvement in a patient's satisfaction with their general physical confidence. It's not a procedure that's going to change your life. It's not a procedure that's going to transform you into somebody different, but I do think it's something that will help a person who has a minimal amount of breast tissue or has lost breast tissue as a result of pregnancy, and that people seem to be very satisfied with it. I think it's very important that you have it done by the highest quality surgeons and professionals and anesthesiologists, and also those that have a staff who are experienced and have a great deal of knowledge regarding the procedure. I do think one thing that always comes up is cost. I think that in general the procedure, if you look around the country, ranges anywhere from just under $4,000 to as high as $7,000 or $8,000. In our practice, we're in about the middle there, somewhere just under $6,000 for the cost. At the low end of the scale, you're getting people who are not board certified surgeons. Your anesthesia is being done by somebody who's not an anesthesiologist. There's very little follow-up care. So I think this is a point in your life where you do not want to take the lowest bidder for a procedure on your body. We do provide a very high-quality service at a competitive price, but I think it's important to understand that you need to be very careful what you're getting with the procedure. All right, we'll look forward to seeing you at Billings Plastic Surgery.